I don't think a lot of Canadians understand the term middle-class entitlements. Can you just explain some of the entitlements that we get?
You might call subsidies to the arts a middle-class entitlement, probably even an upper-class entitlement. The subsidies the CBC gets. Who listens to the CBC? Who listens to those radio programs? The university system. I mean, most people don't know that university costs 10 times as much to the government as students pay in tuition. And the students most likely to go to university are students from families with incomes above the national average. And we know again that an education pays for itself.
You've done some research on middle-class entitlement. I'd like to just turn to that for a couple of minutes. What are middle-class entitlements?
It is very much an income redistribution scheme that carries with it some quite untoward results, such as major subsidies from lower income Canadians to middle and upper income Canadians, and certainly the university educational system would be a classic example that system draws almost exclusively from middle and upper income families, whereas the bulk of the tax funding is coming in from people at the lower end of the scale, so that the individual who drives the bus to get the middle class children out to university in the morning, of course, is also contributing because he's paying a great whacking tax bill to underwrite the educational institution, you see.
There is health care. Now that's a funny one, because what they're starting to find out is that middle and upper middle income families tend to have better access to the Canadian healthcare system because they know, just through their social connections, they know doctors, they know people in the community who will get them to the front of the line.
A senator who can remain unnamed, a Liberal senator, once confided to me that indeed when these programs were being brought forward, I asked the obvious question of why would you not have done away with universality and saved an immense amount of money? And the reason was that if you did that, you wouldn't maintain the support of the middle class for the expansion of the programs. If these programs had been restricted to the poor, I believe that the middle class opinion makers would have been much less vocal in their support of the program.
You're saying that the money's going to the wrong people?
I don't believe that upper income Canadians should take major subsidies from lower income Canadians, which is the case with education and medical care. I think that that's an anomaly, and as I say, I do think that there's a strong political motivation for keeping that system in place because it keeps the opinion leaders on side, if you like.